from Chiba University in Japan. It's a great honor to make a presentation here today. Dr. Han has already given a great lecture regarding my talk into three parts. As you know, Caracia is a benign disease, so it's very important the long-term outcome. In recent years, various comparative studies on treatment have been reported. So today I'd like to summarize and discuss these findings. First, let me briefly explain the treatment strategy. The main treatment for Caracia are pneumatic dilation and oral endoscopic myotomy, plan, and laparoscopic myotomy. Today, I will not cover medication and or botulinum toxin injection. Pneumatic dilation is a very simple procedure. It has a very few complications and can be performed as an outpatient treatment. It is most suitable for type 1 and type 2 Caracia, and it is often the first choice for the patient with high risk for general anesthesia and those who doesn't undergo surgery. Because we use a 30 mm large balloon, so the procedure must be performed under fluoroscopy and cannot be done through the endoscope. The main advantage is its simplicity, and the main disadvantage is that some of the patients, approximately 30 to 50% of the patients need to repeat treatment and due to the recurrence and insufficient treatment. Next is a plan, which becomes the main treatment for Caracia. It can be applied to all types, including type 3. Plan requires a certain level of knowledge and experience according to the Japanese guidelines. Operators are required to have experience with 15 years esophageal ESD cases. Its advantage includes that it's minimally invasive and the length of the myotomy can be really selective. Disadvantage includes approximately 30% risk of reflux esophagitis, and although rare, there are procedure-related complications such as bleeding, pneumatics, pneumoperitoneum, or bleeding. This is a video. This was the video. First, we performed the mucosal incision starting from the anterior wall, approximately 2 o'clock, and after extending the tunnel beyond the rest to about 5 centimeters on the gastric side, similar to the ESD technique, like this. And after that, we cut the muscular area. And basically, only circular muscle layer is cut, and like this. After that, a closer entry to complete the procedure. Laparoscopic myotomy is a traditional surgical option. It is most suitable for type 1 and type 2 Caracia. The advantage of myotomy is that fluidification can be done together, which reduces reflux esophagitis. And Disadvantage the need for general anesthesia and abdominal incision. Now let's look at the result of the comparative studies. This slide shows the 10-year result of a randomized control trial comparing pneumatic dilation and laparoscopic perimyotomy published in GAST last year. In this study, cases that required treatment were considered failure. The success rate was 74% for both pneumatic dilation and laparoscopic perimyotomy, with no significant differences. Pneumatic dilation tends to perform better in type 2 atresia, and perimyotomy tends to perform better in type 3. However, 26% of patients required additional treatment in both treatments. Next, I will introduce two randomized controlled trials comparing pneumatic dilation and POEM in the same cohort, 133 patients. First, the 2 years result. The treatment success was defined as a CAT score of less than 3 without additional treatment. At 2 years, the success rate was 92% for POEM and 54% for pneumatic dilation. Sorry, interruption. Sorry, some of the numbers in the textbook are incorrect, so the numbers on the slide are the correct, so please correct them, these numbers. Refractive psoriasis occurs in 41% of POEM patients and 7% pneumatic dilation patients, which means the reflux was significantly more frequent after POEM. Severe adverse events occurred not in POEM, but pneumatic dilation is 2 cases. Moving on to the 5 years result. Again, sorry, some of the numbers in the textbook are incorrect, so please correct them to these numbers. As 5 years success rate was 81% for POEM and 40% for pneumatic dilation. A patient requires additional treatment was 30% in the POEM group and 41% in the pneumatic dilation group. The use of bronchoprofen filter was significantly higher in the POEM group, 46% compared to 13 patients in the pneumatic dilation group. The frequency of refractive psoriasis is higher as shown on this slide. Next, POEM versus laparoscopic perimyotomy. At 2 years, success rate were similar, 83% for POEM and 81.7% for perimyotomy. A severe adverse event occurs in 2.7% of poem patients and 7.3% of heramyotomy patients. In heramyotomy, the severe adverse events include bleeding and esophageal perforation. Now, let's move on to the treatment strategy according to the achalasia type. This slide shows the success rate of pneumatic dilation and the laparoscopic heramyotomy by type with minimum follow-up of 2 years. In type 1, there was no difference between the groups. In type 3, pneumatic dilation was more successful than laparoscopic heramyotomy, 100% versus 93%. In type 3, laparoscopic heramyotomy tends to be better than pneumatic dilation, 86% versus 40%. This slide shows the retrospective data of poem outcome according to the type. Unfortunately, there is no direct comparison between poem and laparoscopic heramyotomy, specifically for type 3 achalasia. Poem results did not differ significantly among types. Based on these results, for type 1 and type 2, poem, pneumatic dilation, and laparoscopic heramyotomy are all reasonable options. Whereas type 3 is the best treated with poem. Finally, let's discuss recurrent and retreatment cases. First, if a patient has previously undergone pneumatic dilation, does this make subsequent work more difficult? It's very important to select the strategy. The answer is no. Retrospective study shows that fibrosis may be slightly stronger after pneumatic dilation, but does not affect treatment disease. Next, in case of recurrence after laparoscopic heramyotomy, is poem possible? Retrospective randomized trial compared to poem and pneumatic dilation after prior laparoscopic heramyotomy, and reported that 1 year treatment success rate with poem was 62.2%. Although this is lower than the 92% success rate in initial poem, this is at 2 years. It is still considerably better than pneumatic dilation. Finally, factor the treatment option for the recurrence after poem. This slide presents a retrospective study comparing repeat poem and the initial poem. According to the results, repeat poem does not significantly increase the procedure difficulty and is considerable feasible treatment option. In conclusion, poem is effective first-line and rescue therapy for achalasia. Choosing between poem, laparoscopic heramyotomy, and pneumatic dilation should consider patient characteristics, prior intervention, and local experience. Thank you for your attention.